go. Okay. Fantastic. Thank you so much, Shrimi. And it is a real pleasure to be here, just to share some knowledge and perhaps leave today learning some new information and you taking that out there into your community so you can help your nearest and dearest. As Shrimi said, my name is Margie Dangerfield. I'm actually from the northern New South Wales, so I've flown up here for the weekend to be part of this extraordinary event and do what I love, and that is to educate. So yes, I'm a registered nurse, midwife, and before I get on to the family, I just want to let you know why I got involved with this incredible company. So it was 6 years ago. I was working as a nurse in an IVF clinic, a busy clinic in Brisbane, and I was actually in charge of the IVF nursing team. And a very good friend of mine showed me the balance test, and she said to me, Margie, I think you need to take a look at this company. Now, I am a bit of a health junkie. I was always the person coming into work saying, you know, we should do this, we should try this. So of course, when I was shown the balance oil and I took it into my work colleagues, they said, oh no, what is it now? And I said, I have found something that is a game changer. Now, I took the test because I was very interested in knowing what my biomarker was for my health, because I had actually taken omega supplements for 20 years. And when I took the test, my ratio showed me that I had a deficiency in omega-3, and I was shocked. My ratio that Anastasia described, which we should be below 3 to 1, mine came back at 8.5 to 1. Now, as we all are here, you know, want to do the right thing, you're here because you have an interest in health. So I would encourage all of you, whether you're taking an omega supplement or not, please take the test, because that is the baseline. You need to know what this is. So of course, I immediately upgraded my omega-3. I started taking the balance oil, personalised dose by weight. I took 10 mils a day, and I took it consistently for 120 days to then retest and discover my ratio come in at 2.4. So I was very happy, and I knew that this product was a game changer. But the best part for me was that I was struggling with joint pain. So I was 52 at the time. I'm 58 now. I've been taking 10 mils a day for 6 years. And my joint pain, I had brain fog, I had low energy. I'd sort of lost my enthusiasm for life actually, because I was struggling with all the perimenopausal symptoms that we hear about, and we just think, well, that's just part of aging. No. All perimenopause and menopausal symptoms are driven by inflammation. And I didn't really understand that at the time, but I do now. So my brain fog lifted. In 3 weeks, my joint pain had completely disappeared, and I started to remember things in the workplace because I was forgetting things. So over the course of time, my hair, my skin, my nails, everything started to improve, and I just thought, wow, if this has happened to me, then I want to go on and share this. And I started to share it with my family, because my family had some health challenges and their health started to improve. And then I went, you know what? Why are we not using this biomarker in clinical practice in the workplace? Because all of our patients had chronic inflammation. So I took it to the IVF specialist that I was working with at the time, and I was very fortunate because I'd worked with them for a long time, and they knew that if I was excited and enthusiastic about something, so there had to be some evidence behind it, because in medicine and health and wellness space, it all comes down to data-driven and science and research. So I showed it to the fertility specialist and they agreed. They said, yep, let's use it with some of the patients. And of course, in the IVF space, a lot of women are going through IVF because they have endometriosis, that's the largest cohort, but there's so many other factors, unexplained infertility, PCOS, male factor. All of the things that we talked about that's driving chronic disease also drives infertility. And we started to test the patients and we started to put them on the balance oil. And that's when we saw a dramatic reduction in chronic pelvic pain. Within the very first month of women going on this oil, their pain would go from about a 10 out of 10 down to a 3 out of 10. And that was profound. That was life-changing for these women. We saw endometrial thickening, we had better outcomes with treatment cycles, we even had couples conceiving naturally, and that was exciting. So, yes, I've seen this work over hundreds of patients and in my own family, but my most important role is actually being a mum. And that's why these are my beautiful 5 children, and I've only given birth to 2 of them. So, but my partner and I have been a blended family for 18 years. And of course, every mum wants the best for their kids. So even though they were young adults when I discovered Zinzino, of course, what does every mum do? Share it with the family. So of course I tested all of the children. And of course their ratios came back between 18 to 26 to 1. Now we eat well, but again, we were lacking this fundamental nutrient that is so difficult to get in our modern day diet, as Anastasia explained. Wild caught oily fatty fish is just so hard to get. And if you do find it, it's expensive. So to feed a family of 7, 5 serves a week, that is just unaffordable. So we put everyone on the balance oil. In fact, one of the boys, he refused to get tested in the beginning. He thought I was sending his DNA somewhere weird. So he refused. And it took him 5 weeks before he was convinced that he should get tested. He took the oil religiously, and then he came to me and he said, "Mum, I'm ready to get tested." I said, "I'm not testing you now. You've taken the oil for 5 weeks." But of course I tested him, and he was still deficient. Because remember, this is a 120-day program. This is not a one-bottle fixture problem, and that's why we like to have this 6-month cellular correction program that we offer for our clients. So, what I want to share with you is my passion, and that is, as a midwife, understanding and helping women explore and really understand what it means to get your essential fatty acids in that optimal target range for motherhood. So, why is omega-3 so important then? Well, interestingly, for adults, of course, we all know the importance of omega-3 for cardiovascular health. But for motherhood, it's all about the development of the brain. And I'm not just talking the baby's brain, it's the mother's brain as well. And the mother is the only source of nutrition for her baby. A lot of people don't realise the importance of omega-3 for vision, but this is another critical area that we require omega-3 for normal vision development. So if we're talking about building brains for our babies and for the next generation, it's important to know that this happens even well before conception. So if you know someone who's trying to have a baby, or who is pregnant, or even breastfeeding, or looking at having another baby, please share this information with them, because it's the 1,000 days, the first 1,000 days from conception, that has the most critical impact on that development of a baby's brain. And it is actually the building blocks. So, of course, the omega-3 is passed through the breast milk when the woman's breastfeeding, but as soon as the baby's off the breast, babies can start the balance oil. And I'm going to talk about kids in a moment. But it actually will impact their future health. We know that kids that have optimal omega-3 index are more intelligent children. And they're more socially and emotionally regulated, and they are able to cope better at life and have better opportunities. So that's well documented in the literature. So let's talk about pregnancy to start with, because this is where it all begins. Now, DHA, so omega-3 is a combination of EPA and DHA. And it's during this development, the first, the second and the third trimester, that the ability for that baby to uptake DHA from the mother is so important. In fact, 70% of the neuronal development is occurring in pregnancy. And it's in the 3rd trimester, which is where there's a rapid accumulation of DHA for the baby's brain. Now, I get really concerned because I've talked to a lot of pregnant women, and even though there's a lot of research around DHA, we need our pregnant mothers to understand you need a formulation that has EPA and DHA, because there's supplements out there on the market that are just targeting DHA. And I've spoken to a lot of women that said, oh yeah, I'm using this wonderful DHA product, but it doesn't have EPA in it. Now, we need EPA because EPA modulates the DHA across the placenta and enables the baby for it to be taken up into its own stores. So the other topic that I love to educate on is reducing the risk of early preterm birth. So we know, and there's incredible large meta-analysis and randomised controlled trials that have been done to show that women who have low omega-3 index are at risk of early preterm birth. Now, having a baby before 34 weeks is a high risk for infant mortality and disability, and that places a huge burden on families and public health. So what we can do, we can offer women, in fact, Australia is leading the way in research. So I'm so proud to say that in 2019, this was rolled out as a strategy in Australia that every single pregnant woman should have their omega-3 index tested. Now, in the world of research and science, it takes about 17 years for this information to trickle down into practical terms. And all the mums that I was working with, I would say to them, has your care provider told you about the importance of getting your omega-3 tested during your pregnancy? And every single woman said no. Now, this is shocking because it's such a critical part of the information. So what we do with Synzino, we are tackling this head on. We don't wait 17 years to get this into the community. We're having meaningful conversation with our community and events like this where we can share this information. So again, if you do know someone who's pregnant, please get them in touch with the person who invited you here today, because we want them to get tested and we want to encourage pregnant women to reduce this risk, and particularly with rural communities where babies get, transferred into large centres and they're separated from their families. It comes with an enormous amount of trauma. So the other really important thing I like to talk about is the risk of postpartum depression. So there's, again, a lot of clinical evidence showing that women with low DHA values have higher risk of postpartum depressive symptoms. Now, 1 in 7 women are diagnosed with postpartum depression, and that is staggering. So we shouldn't let this happen. We have something that we can measure. We have something that we can give to our family and friends to say, take this into your own hands. Let's see what your levels are. Because in the studies that have been done, we know that even if we raise this plasma DHA level by 1%, we can reduce the postpartum depressive symptoms by 59%, which is extraordinary. And that creates happy families. So just so you understand, the balance oil, it ticks all the boxes as far as minimum requirements of EPA and DHA. It is a beautiful blend, and it also comes in capsules because a lot of women with morning sickness sometimes don't like the oil, so we flex between water soluble and this product. It is brilliant. But moving on to our babies, we all want children to thrive. In fact, even big kids need to thrive. So we need to understand that omega-3 plays a critical role in the development of our babies' brains. And sadly, today, we have a situation on our hands where we have a world of problems with our children's health. And unfortunately, the most common neurodevelopmental disorder we're seeing is ADHD. Now, in Australia, the prevalence is around 1 in 20 from the data that I've looked at. But if you're talking to teachers in the classroom, they're going to tell you that's higher. They've got classrooms that are chaotic and they have a whole range of issues that they're dealing with that impacts families. And 60% of these children are actually prescribed stimulant medication, which can become problematic in itself. And if it's above 10 to 14, that's even a higher statistic. So this is going to negatively impact the children's education, their ability to learn, their ability to be emotionally mature. And the 50 to 70% of children also, 50 to 70% of children with ADHD also have additional developmental and mental health disorders. So we've got something with Zenzino that can actually help these kids. In fact, we work heavily in this space with autism spectrum and ADHD. And we've been using this formulation with these children for a long time, and I've seen firsthand non-verbal autistic children who are speaking within 12 days of being on this formulation. And it is extraordinary, and it is life-changing for families. So again, if you keep going back to the data, we know that these children have been found to have low omega-3 levels in their cell membrane. Their requirements are higher. For kids, it's all about cognition. So we need to help the children who are struggling, and you know, they've got the hyperactivity, they're anxious. In fact, the average age onset of depression now is 14. Our kids are going to school anxious, they're having trouble, and we need to get this message out to them. We need to test our children, and we need to bring them back into balance so they can thrive. So it's well recognised that dietary supplementation is supporting in this way, particularly for ADHD children. But this study I found amazing, because we live in a world today where we're seeing more aggression, we're seeing more violence, and sometimes I think, what is going wrong in the world? Like, what is actually happening? And we know that there's, like, this meta-analysis was actually released last year in 2024. It was looking at society and what was happening, and we're putting children on psychiatric drugs that come with their own risks, okay, and accidental overdoses. This is not the solution. We know that we can reduce even aggression by up to 28% by using one nutrient. It's omega-3, and an omega-3 that we know works. It's safe, it's cost-effective, and it's across all ages. So I would encourage people to, again, get tested. Why? Because we don't know if the product that you've been using, there's probably a lot of people in here who use omega-3 or have given it to their children, but they just don't know that the formulation they're using is not working. So children's blood levels are different, we know that. Why? Because we've got the largest database of its kind globally. We've tested hundreds of thousands of children, and we know that their metabolic requirements are higher. So when we know adults are requirement 8% of their blood profile to be omega-3, and the ratio should be 3:1, kids are a little bit different. Their omega-6-3 ratio should be 5:1 or lower, and their omega-3 index at 6%. So testing is critical. Now, I want you to go to this test site. I want you to go to zenzinotest.com. I want you to do your own research. I want you to look at the data and understand why kids' needs are different. We're the only company globally that understand this. And unfortunately, the situation we're in today, 95% of the children are just not getting enough omega-3, and the supplements on the market are just not doing their job. So step one, take the test. Test the family, test your children, and test your friends. And step two is offer a safe, proven strategy that can bring your kids back into balance. It's been designed by scientists, but approved by kids. And our big kids love it too. So I want to share in closing 2 results with you, because I think it's always important to have a look at this. And the reason I like to show this one from Nate is 8 years old. This is from a family who are eating clean, organic, whole foods, doing all the right things. There's no problem with the arachidonic acid because that's omega-6, so they're not over consuming omega, ultra processed and processed foods. But what was the missing piece of the puzzle for this little boy that was having problems in the classroom was that he is extremely deficient in omega-3. His omega-3 index is only half of what it should be. So we'll be following his progress. And this little boy, Jacob, with ADHD and visual impairment, lots of learning behavioural problems, came in at 23 to 1, 120 days later, 4.2. Now with the approval of the school and the parents, we were able to share this information with you because overall this young boy is calmer, he's a better communicator, he's coping in the classroom, he's able to respond more effectively and with his rules and timetables. So he's having less impulsive, aggressive outbursts and he's just becoming a better, thriving child. So if you are thinking that this resonates with you, please go out and share this information with your community because we truly believe we can have an incredible impact on the world. Thank you.